Hello everyone, our today's topic is TMJ, that is the Temporomandibular Joint. It is the only mobile joint of the skull. This is the special joint because it allows us to perform everyday activities like chewing, speaking, yawning, laughing. This is formed between the articular fossa of the temporal bone, right? Articular fossa of the temporal bone and the head of the mandible. So this is the little review. This is the body, ramus, and this is the head of the mandible, head, neck, coronoid process, and this is the condylar process. The condylar process, the coronoid process, it is free. The joint is made by the condylar process of the mandible. Okay, this is the head of the mandible, condylar process, neck of the mandible, this is the body, and it's the ramus. This is a coronoid process which is free. It's the temporal bone, squamous part of the temporal bone. This is the zygomatic process of the temporal bone, styloid process of the temporal bone, and this is the mastoid part of the temporal bone. This part is known as mandibular fossa. Here the head of the mandible attach like this and will form the TMJ, temporomandibular joint. So this is the temporal bone. This is the mastoid process of the temporal bone. Mastoid process of temporal bone, right? And this is the in front of the mastoid process, there is the external auditory canal, and in front of this, here is the tympanic plate of temporal bone. Tympanic plate of temporal bone. This is the zygomatic process of temporal bone, and this one is the mandibular fossa. Here in the mandibular fossa, the head of the mandible will lodged. This is the mandibular fossa. It is present in the zygomatic process of the temporal bone. See, this is the temporal bone. Okay, this is the zygomatic process of the temporal bone, and here it is the mandibular fossa, and this is the bulge, and this is known as the tubercle or eminence. Tubercle or eminence. So this anterior part is the articular tubercle or eminence. Eminence. Okay. So the temporomandibular joint is formed by two bones, simply the two bones, the temporal bone and the mandible. The condylar part of the mandible is lodged into the mandibular fossa of the temporal bone. It's a simple definition. In complex way, you will find the mandibular fossa. In front of the mandibular fossa, there is the articular tubercle or eminence, and behind it, you will find the tympanic plate, which is present anterior to the external auditory canal. So you will say the articulation. Number one question is the articulation of the TMJ. Two bones, temporal bone plus mandibular bone. Okay, now which parts? First is the mandibular fossa, mandibular fossa, number 1. Number 2 is the articular tubercle. Articular tubercle or eminence. Here it is, the articular tubercle or eminence. This is the mandibular fossa, mandibular fossa. And third one is the tympanic plate, tympanic plate. Another one, mandible bone, the head of the mandible, head of mandible, or condylar part of the mandible, okay. So condylar part of the mandible. I hope it's clear. As you can see here, this is the temporal bone, this is the mandible bone, this is the zygomatic process of the temporal bone. Here it is the mandibular fossa, here it is the mandibular fossa, and this is the external auditory canal, and this is the tympanic plate, and this is the articular tubercle or eminence. So this is the temporal bone, and this is the mandible, and this is the condylar part and head and neck of the mandible. This is the coronoid part of the mandible. It is the only movable joint of the skull. Remember it, it is the only movable joint of the skull. It is a synovial type of joint, but unlike other synovial joint, its articular surfaces are covered by the fibrocartilage. You know the synovial joints are covered by the hyaline cartilage, but this joint is covered by the fibrocartilage. So it provides stronger and better strength to the joint while chewing or other forcible movements. It is covered by the capsule. Now 3 ligaments. Number 1 is the temporomandibular ligament. Temporomandibular ligament. Easy. Temporomandibular ligament. Mandibular ligament. Number 1. Number 2 is the stylomandibular ligament. It's a stylite process and it's the mandible. So number 2 is the stylomandibular ligament. Last one is the sphenomandibular ligament. Now you can imagine here is this spheno inside. It is the third one. Sphenomandibular ligament. From temporal bone towards the mandible, the temporomandibular ligament. From stylite process towards the mandible, stylomandibular ligament. From sphenoid bone towards the mandible is the sphenomandibular ligament. Now there are 5 things. Number 1 is the fibrous capsule. Number 1. Number 2 is the disc, articular disc. Number 3 is the temporomandibular ligament. Number 4 is the stylomandibular ligament. Number 5 is the sphenomandibular ligament. Sphenomandibular ligament. So number 1 is the capsule, articular disc, temporomandibular ligament, stylomandibular ligament, and last is the sphenomandibular ligament. Here are 3 arteries: superficial temporal artery. Number 2nd is the middle meningeal artery, and the maxillary artery. 1, 2, 3. Superficial temporal, middle meningeal, and maxillary artery. So the movement I will tell you in another video. Okay, Allah Hafiz.